And I call to order the meeting of the Metropolitan Council Transportation Committee for November 13th, 2023. If there's no changes to the agenda, we can proceed. Seeing none, we can move on to our next item, which is the approval of the October 23rd, 2023 minutes. Did anyone have any changes or additions? Seeing and hearing none, I entertain a motion to approve the minutes.
So moved.
Moved by Councilmember Vento. Is there a second?
Second.
Second by Councilmember Pacheco. Is there any other discussion? All those in favor say aye.
Aye.
Opposed, nay. And the minutes are adopted. We're on to reports. We have MTS Services Executive Director Carlson.
Thank you, Madam Chair. Good afternoon, council members. Just one report for you tonight. I mentioned in the last meeting that we would be hosting some policies and actions workshops in relation to the transportation policy plan with staff from partners around the region. I'm pleased to report we held those workshops. We had about 80 attendees from across the region between the three workshops, so 2 in person and 1 in virtual. Multiple state agencies, including MnDOT, the Department of Health and Pollution Control Agency, and then somebody from each county, from transit agencies and from cities around the region. So good workshops. We shared content that was developed through 8 policy teams, which I won't list them all, but they vary by topic area from safety to public health to natural systems and transportation resilience. So teams created those. The teams were made up of experts in those areas from around the region, including state agencies, from local partners as well. We reviewed and brought forward items from those work teams that was most aligned with our regional role and within the authority of the council. So we got a lot of really good feedback on the policies and actions that were developed in draft form. Next, we'd be reviewing those comments internally and then bringing a proposed back to those policy teams in December and then to the advisory work group for the TPP that some of you are part of in January or February, and then into the broader council process for Imagine 2050 and the related subplans from there. With that, Madam Chair, I'd be happy to answer any questions.
Very good. Thank you. Questions or comments from council members? That's good. All right. Thank you.
Thank you.
All right. Now we're on to Metro Transit General Manager Kinderis.
Chair Barber, council members, just a couple updates for you today. First, regarding the Transit Rider Investment Program, just wanted to highlight for you that starting last week, we began publicly communicating that we will start having community service officers inspect fares and issue administrative citations in December. So this is one additional step towards fully implementing the Transit Rider Investment Program. And we are trying to get that information out to customers so they know what to expect in advance of that starting. And second update, just wanted to remind this group that each month Metro Transit organizes what we're calling Great Day in Transit. I know we've mentioned it before, but this is where we organize staff from across the agency to spend a portion of their day on our system, thanking our frontline employees who are out there working, as well as our customers. We do that the 3rd Wednesday of every month, and you're always welcome to join us. We're doing it this Wednesday, and it'll be our first time moving on to vehicles more, even though it's going to be a beautiful day, but we figured November, probably time to start moving it a bit more indoors. So just wanted to put that plug out there, and certainly happy to provide more information if you'd ever want to join us for one of those Wednesdays. So with that, Madam Chair, I'd take any questions.
Very good. Thank you. Questions or comments from committee members? All right, thank you. And we don't have our TAAC representative here tonight, so we won't have that report. So we can move on to our consent agenda. There are 2 items on consent. I'd entertain a motion to approve the items on consent.
Motion to approve.
Moved by Councilmember Chambliss. Is there a second?
Second.
Second by Councilmember Carter. Is there any other discussion? All those in favor say aye.
Aye.
Opposed, nay. And the motion carries. We're on to our one item that we have on non-consent business, which is business item 2023-210, which is the 2022 Service Equity Evaluation Report and Title VI Review. We have Victoria, Dan, and Celina Martina here. Welcome.
Hello, Madam Chair. Hello, council members. Okay.
Afternoon.
Good afternoon. My name is Celina Martina. I'm the Senior Manager of Equity Inclusion here at Metro Transit, and I'm here with Victoria. She'll introduce herself in a little bit. We're here to present the Service Equity Evaluation from 2022. So, Victoria, you want to introduce yourself?
Yes, certainly. Good afternoon, Victoria Dam with Metro Transit Service Development. I'm a senior planner here to co-present.
Yes. So I want to present this work by saying that what you hear today in this presentation is a combination, if you will, of compliance and work that we have to do due to federal regulations and Title VI work, but also going beyond the compliance work and equity work, how our agency takes really a look at data and processes to ensure that we understand deeply the impact on our regional community. So before we start presenting some of that data and the results of a 2022 service equity evaluation, I like us to think about that this is in 2022. So the data we are presenting to you is is now a year old, and so it's retrospective. So it includes the service equity evaluation and the Title VI service equity analysis that we conducted in the 12-month period of 2022. It's cumulative, so it's from January of 2022 to December of 2022. We have presented to you the 2021 service equity evaluation last year. And you will hear probably not so late next year, but a lot of the changes we made in 2023 that hopefully will be reflected in the evaluation we'll conduct upon the culmination of this year. So this is important to have in context. So what does the service equity evaluation tell us? So it tells us a little bit of, how our service changes between 21 and 22 were conducted. Perhaps a little bit about ridership pattern change, but we'll talk a little bit about how those metrics are, the methodology behind the metrics, so you understand what we are measuring. Have our service changes conducted in 2022, have they met the Title VI federal guidelines and thresholds? Also, we are presenting to you today information about our equity metrics or service equity metrics that are in three categories: service availability, service quality, and service outcomes. And this practice, we're very proud of this practice because it continues to promote how we look at equity when we make decisions such as service decisions. I'm going to pass it to Victoria now.
Thank you.
We're co-presenting, so it's kind of like watching a TV show here.
So before we dive into the changes made in 2022, I just want to highlight a couple of key contextual points. One is that while in 2022 there was some return to in-person activities, it was not a complete return, and we're all still familiar with the amount of work from home and remote learning that still does occur. The second item would be that in 2022 we continued to face an ongoing workforce shortage. That isn't necessarily the case today, but that definitely does frame the decisions in 2022. And despite efforts to increase wages and improve recruitment, it just wasn't enough in many cases to address that shortage, and we needed to make planned service changes. So starting in the beginning of 2022, we need to set that baseline before we can look at the changes that happened through the rest of the year. So what did that baseline even look like? What it looked like was much like December of 2021, where we made significant service reductions as well, also due to the operator shortage at that time, where system-wide we made a 5% service reduction to help balance availability of operators with the service scheduled. So that carried on into much of the first half of 2022. So I'll walk you through kind of the different periods of service changes throughout that year, where, as I mentioned, 2021 changes carried through the beginning of 2022, a pretty quiet period in terms of service changes, where a lot of the balancing act from December of 2021 helped us to mitigate some ongoing shortage trajectories. But by fall of 2022, we were still seeing that we were cutting trips due to the shortage, and we did need to make additional reductions and suspensions. By December of 2022, we were making more reductions and suspensions. About 8% of service levels were reduced, as well as in the same period, opening up the Metro D-Line, arterial bus rapid transit, the Chicago Fremont Emerson corridor, which did have a significant replacement of local services in that same corridor. So what I'm showing here in this map is at the end of 2022, how many trips were scheduled by stop in the service area. And the bigger circles are correlated with the higher volume of scheduled trips at that stop. They're mostly along our metro lines and our high-frequency service. Another way to show this data is to break up the trips by the route classification, so local service, bus rapid transit, light rail, and commuter service. You can see that the lion's share is distributed among local service. Although with the opening of the D-Line in 2022, we saw some of that service availability be reallocated to the BRT, which again, as I mentioned, did substantially replace other local service in its corridor. Another way to look at the data from December 2021 to December 2022 is to look at the ridership by route classification. So unsurprisingly, where we have the most service scheduled on our local routes, we have the highest ridership. We also see that on BRT, where we opened the D-Line, and generally speaking, we've seen growth in those corridors. We've seen BRT ridership continuously go up. I'll also note that in the commuter market, we have not seen as much substantial growth. It's pretty minimal over the past year in 2022 in that market, and it remains a small share of our overall transit ridership. Another way to show this is to map it out. This looks very similar to the previous dot map, except this shows the ridership by stop. Again, a lot of that ridership is occurring at metro stations and along our highest frequency routes. I'll also note, and this will become more clear in a later slide, that many of these corridors, these higher frequency corridors, are also serving our BIPOC and low-income communities in the service area. So now that we've had an overview of all these service changes that have occurred in 2022, we next need to take a look at whether or not these cumulative changes are potentially discriminatory. So the FTA does require all transit agencies that receive federal funding to comply with Title VI, as Celina was mentioning. And Title VI of the Civil Rights Act of 1964 that does protect low-income and minority groups. And the tool for doing this analysis is called the Service Equity Analysis, or the SEA. And for the purposes of this presentation, I'm going to be referring specifically to Black, Indigenous, people of color, or communities of color, or people of color, when I talk specifically about minority groups in this context. So what the SEA does is it reviews how access to transit has changed over the course of this year in this analytical context. And when we say access to transit, we're thinking of how many trips are scheduled that can be accessed from the average residence. And we can parse that out by demographic information to understand how those impacts might be different based on race or income. The one caveat that I will mention here is that this methodology, which is prescribed by the FTA, is really based on home locations and census data, but it doesn't really shed light on the actual travel patterns of people. So we don't exactly know from this analysis how people are moving beyond their home location. A couple of other notes related to the policy around Title VI at the Council on Metro Transit. The first is that the FTA does require for agencies to define what is a major service change, because a major service change is what triggers the requirement for a service equity analysis. And at Metro Transit, we use a 25% change, positive or negative, on a route or in an area to qualify as a major service change. So that could be new routes, eliminated services, or reductions or added trips. The other policy that is relevant here is the disparate impact and disproportionate burden threshold. I will sometimes refer to this as DIDB for efficiency. So what this threshold says, or what it does, is it determines when a difference defined by found in the service equity analysis, when that difference is significant enough to result in a potential for discrimination. So we recently updated what that DIDB policy threshold is, and it's more stringent than it was in the past. And essentially, it is if adverse or beneficial effects of service changes borne by BIPOC or low-income groups are not within 10% of the effects borne by white or non-low-income populations, respectively, then there is potential for discrimination. One side note here is that if there is an identified beneficial effect beyond 10% to BIPOC or low-income groups, it is not considered evidence of discrimination. So this brings us to the SEA analysis, starting with kind of a baseline of information about the communities who live along routes in our service area. So these two maps show two different demographic qualities. The first is the share of population who are people of color. And the second map on the right is the share of population who have low incomes. So they're not necessarily identical maps, but there are areas where they overlap. And if you recall the previous maps that showed trip availability or scheduled trips and ridership, you can kind of see the relationship between those corridors and the demographics of the area. And getting at the aspect of the SEA that looks at the change in access to transit trips, this map on the left visualizes what that net difference is from December 2021 to December 2022, where the kind of orange to red color shows us net decreases in availability of trips, and the bluish color gradient refers to areas where there is a net increase in service availability. So some of the bluer areas you'll see are largely due to the D-line opening. The chart on the right, once you aggregate all of that access information into some clean, neat statistics, we can see that essentially white, non-Hispanic, and non-low-income populations in the service area saw roughly an 8% decline in their access to transit from their home origin. But on the other hand, BIPOC and low-income residents in the service area saw nearly 0% change in their transit access, which, as we've described, there were significant service reductions in 2022. So those changes were fairly effective at protecting our minority and low-income groups from the impacts of reductions.
Thank you, Victoria. And as I mentioned earlier, this is a combination of a presentation. So you just heard about what we have to do, we must do to comply to federal law. And this is what Metro Transit is committed to do, to continue to learn about the impact of service changes and service to our communities of color. So we have what we call the service metrics, that these are all metrics that are disaggregated by race and ethnicity. I want to remind us, these, again, are metrics that were calculated in 2022. And in addition, we have a methodology. We developed a methodology here at Metro Transit where we also use the census data to create these metrics. So these are metrics that are, and I'm not going to be able to tell you exactly the methodology. We have data scientists, Dr. Joey Reed, and the Strategic Initiative. They do a tremendous job, and they're well known nationwide about the development of these metrics for service. So if you have questions about that, I can get back to you, but certainly I can tell you that these are metrics that consider the location, the bus stop, and not, the travel pattern. So as I said, there are metrics around availability. So we count trips and we look into frequent service, metrics that we define them as reliability metrics, so on-time performance and service delivery, and also service outcomes. So let's start with the first metric. And this is related to service or trip count. As you can see, there is a black line across the axis there, and it is our regional average. So our regional average is about 51 trips, and you can see that residents who identify as American Indian and African American have a higher average of trip counts than other groups. So this was during 2022. we offer more trips to our communities that identify as Black or Native. The next metric is the high-frequency service. Again, we have our regional average is around 28%. So it's a similar trend for percentage of high-frequency service. In this graph, you can see that our BIPOC communities have similar or higher access to the average. Again, our Black and Native residents have a significant higher percentage of access to high-frequency services, close to 45% and 41% respectively, Native and Black communities. On-time performance, and I want to talk about on-time performance. This is not only an service equity metric that we look into on-time performance impact on our communities of color, but this is a key performance indicator, and there is a lot of things that factor in on-time performance. You can imagine traffic patterns, road conditions, weather, snow removal. There's so many things that impact our on-time performance, including, sometimes we are actually talking around our trains and people holding doors and things like that. So everything, there's a lot of factors that impact on-time performance. You can see that overall, the on-time performance is near 80% of our regional average. However, we see that Native and Black residents experience a lower percentage of reliability or on-time performance than other groups. So we continue to monitor this, and we think that year over year we keep this metric to understand trends and mitigations.
Oh, do you want me to wait?
Councilmember, do you mind?
No, I don't
Councilmember
mind.
Vento?
No.
Yeah, I have a question. Thank you, Madam Chair. I'm wondering if, because Black or Native American had access to more trips,
Yeah.
that might in some way contribute to them having access to less reliable service, at least in the case of Native American. Yeah, both, I guess.
Yeah, Madam Chair, Councilmember Vento, thank you for that question and clarification. Certainly, we look into that, because we offer more trips, there may be a correlation on-time performance, how our communities experience, since they have more access to trips. It's something that, again, we don't have the calculation to say yes or no, but certainly it's a consideration. So, yeah, we're looking into that.
Thank you.
Yeah.
Councilmember Chambliss?
Thanks. I just had a question about the time period for the charts on 17 through 19. Are those for 2022?
Yes.
Okay.
I'm sorry.
Councilmember Carter?
On the charts that you presented earlier when you were speaking about the impact to BIPOC and low-income communities, you shared that a 25% change is considered a major change by the FTA. Is that cumulative, or is that year to year? In other words, if that change were to equal 25% over a period of years, would it be then a major change? Or are we just looking at from one change to the next, even within a period of a year?
Madam Chair, Councilmember Carter, that this is, a question that is certainly, I think, very routine for service development. The 25% in hours in this context relates to service hours that are planned. So in this context, when we're looking at 2021 versus 2022, we are taking kind of the aggregate number of service hours scheduled on our system in 2021 and comparing it to 2022. So if, for say, you had 20 hours scheduled on a route, and you were to reduce it by 25% to only be running for 15 hours, that could trigger a service equity analysis that could be considered a major service change. And in this case, it depends on kind of the scale of the service equity analysis. In this case, we're doing an annualized version, but there are definitely periods when you can have a shorter period where you're doing that analysis. You could probably have a longer route period, yeah. So for our purposes, this is December 2021 to December 2022 for that percent change in service hours.
And that is how we've designed to look at that. But in terms of how the major change alert gets triggered, does the FTA ever look at longer periods? I'm sorry,
Yes,
Mr. Harrington is coming up to the table.
Madam Chair, Councilmember Adam Harrington, Director of Service Development. Our council policy is that when we make a change for one change of that route, so if we did a change on August 24th and it changed that service about 25% plus or minus, that would trigger a Title VI review. So in this presentation, we're looking at the cumulative, and it captures many of those situations over the course of that year where we're looking at service changes that either cumulatively or individually come to 25% for a route or a corridor.
I thank you. I still don't quite have that answer, and I will pause on it, thanking you all for your attempts. It must just be me. I will just reiterate, though, that I'm curious about whether we look over longer periods of time, and in particular, as we've thought through the entire period, of pandemic since 2020 to 2023. I'm curious whether there have been any major changes of that sort.
So, Madam Chair, Council Member, there certainly have been, and one of the things that the General Manager asked us to do each year, starting in 2020, was to look at the whole year, because since 2020, we have not had this scale of change and this level of dynamic in our system unless it was an intentionally planned new service where we're making changes. So it's been very dynamic. We've had previous service equity evaluations for the last 3 years that look at that year over year. And so this rolls that up for this 1 year, but we certainly have over the past 3. And each, when we think of our triennial review, which we do every 3 years for the FTA, those are also noted as part of that package as well. So we do track that over time.
Okay, and we get to see that as well when that comes up.
And I would say
Thank you for taking time with me.
this is sort of a good way to look at it every year, see the trends, but if something does hit that 25% mark for a single change, it means it can't get buried in the data, and we have to look at those individually as well. So both the longer view, but also making sure single incidences and single changes don't hit that threshold, or we have an understanding of the impact if it does.
Great.
Yeah.
It's good to know that both happen.
We've got one more question, and I'll turn it back to
Oh,
you.
yeah.
Is that, Councilmember Dolker.
So I walked in late, and so I may have missed it. Would you mind just summarizing what are the headlines coming out? So setting aside individual charts that's telling you the story about what the transit services are and the impacts on BIPOC or race and ethnicity, what is the headline we're looking at in terms of what is the data telling you in terms of the transit services we're providing and how are the people impacted?
If I may, we still have a few more slides, but that's the kind of the right question maybe at the end, if that's okay. Does that make sense to you guys? Okay.
Sure. So, Madam Chair, another point of clarification that may help you, Councilmember Carter, is that the FTA doesn't give us a prescribed number for what is a service change that is significant. We determine that by policy. So transit agencies determine that by policy, and they determine also what is the level for disparate impact. So they give us a prescriptive evaluation, but they don't tell us 25% should be enough for you to conduct this. So I just wanted to present that information.
That's helpful.
So with this metric, which is the reliability of our service scheduled and delivered, you can see that year over year we have increased. I mean, we have already a very high percentage of service delivered. So you can see that in 2021, despite all the challenges with workforce challenges, we had a 97.5% of service delivered. And in 2022, although a lot of those challenges persisted, as Victoria said, with workforce, we have increased our service delivered almost to 99%. but we also have closed the gaps between communities. So that is important to say, because although there are differences between our communities, and you can see 0.15%, we have closed those gaps. So that is the one takeaway of like continue to monitor these and look how those continue to shorten. This is an inverted chart because it tells us a little bit about cut trips. We do our very best and the impossible to not cut trips. That is the total last resort we have, to not deploy a trip. However, we know that, again, there are a lot of factors that influence why we may have to cut trips. And during 2022, operator shortage was one of the factors and one of the main factors of why we had to cut trips. As you can see, there is also a regional average or an average of cut trips that we conduct in the year, and you see that there are more trips cut to communities that identify as Black and Native. And again, we tend to have more counts of trips to those communities. In addition, when we have to cut trips, we have practices at the garage level where we try to cut trips that have higher frequency and not cut a trip that may, you have to wait 2 hours for the next bus to come. So perhaps we'll tend to cut some route that has a 15 minutes or 20 minutes frequency rather than, one that has 40 minutes or longer. So that's one, that's the cut trips metric. The last metric I have to present today is we look at the job availability, where's our service, and how our communities may have opportunity to access jobs. In our Twin Cities, or metropolitan area, you can see that residents identifying as Black, Native, Hispanic have more access to jobs. As you can see in that map, the green colors can tell you a little bit of like some of our major BRTs and LRT service and how those are great connectors to jobs and opportunities. So you can see the green line there, you can see the blue line, and as well as the A line that have been significant, high frequency service for our communities to access jobs at different, throughout different parts of those corridors. Victoria, you're next.
Thank you. And before we wrap up this presentation, I did want to touch on some ways in which equity practices do, like Title VI and the SEA and the Service Equity Evaluation, inform our everyday planning practices at Metro Transit. So first, just starting with Title VI, I mentioned that we updated our DIDB policy threshold. That was part of our most recent Title VI plan update. We also recently, in the past couple of years, completed a service monitoring study, and that's a requirement every 3 years. We also conducted separate service equity analyses for the opening of the D line and its associated route changes, as well as a separate SEA for the December 2022 service changes. So all 3 of those analyses or studies, the service monitoring study and those 2 SEAs, they all concluded that there was no DIDB impact in those studies. So good news from that front. In terms of how equity plays a role in some of our other practices outside of Title VI, one, Metro Transit has an adopted transit equity statement, and that informs our kind of everyday decision-making. Network Now, which you might be familiar with by now, is our near-term vision for the transit network through 2027, and that is also guided by several principles, including equity. We also incorporate, as a typical practice, equity in our customer surveys. You'll hear more about the onboard survey, which was going to be my example, but I'll have Brandon explain more of that in his presentation. But certainly, efforts like the onboard survey help us understand how equitably transit is working for riders and people in our communities. And then lastly, I'll point out that speed and reliability, another initiative and program at Metro Transit, the way that it selects and prioritizes improvements to routes does indeed prioritize routes and corridors with more BIPOC riders and with more low-income riders on those routes. So with all that said, our proposed action for business item 2023-210 is that the Metropolitan Council approve the results of the 2022 Title VI Service Equity Analysis for the 2022 Service Equity Evaluation Report.
Good, thank you. And to, I guess, for Councilmember Dolkar, like what is, for each of you, what's your headline from this work?
Madam Chair Barber and Councilmember Dolkar, we started this process or this comprehensive evaluation in 2020, and in 2020 we had slightly different metrics. For example, we identified that I don't know if I'm saying this right, but crowdiness, like bus crowdiness or vehicle crowdiness, was something important for us to know based on what we knew about the pandemic in 2020. And we wanted to know how that affected our communities of color. So we evaluated in our 2020 service equity evaluation that metric and understood a little bit better the impact. By 2021, things were different. So, we reevaluated the set of metrics and we said, okay, we are having some issues with operator hiring and we know that there are more cut trips than we anticipate to do. So we started, we dropped the vehicle crowdiness, if you will, metric, and we started analyzing cut trips. So what we do every year we're looking at the metrics that, based on what we know from our customer surveys, our service development practice, what we hear from operations and what's happening on the garage, what would be metrics that are relevant to continue to monitor and see trends? So there are some standard metrics such as, frequency, number of trips, but the reliability metrics is something that we will continue to monitor to ensure that especially our communities of color, can rely on our service and can count our service to, take them to their jobs, to their social gatherings, or, whatever they need to be. So those are, some of the takeaways. I don't know if Victoria, you have any more.
Sure. Yeah, Madam Chair. My takeaway from my half of the presentation would be that 2022 was a challenging year due to the operator shortage, and it was necessary to make service reductions where we could with the information that we had and the timeline that we had available to make those reductions in a responsible manner that mitigated the impacts where we knew that it was smarter and wiser to make those reductions. And so the outcome of those cumulative net changes from 2022 have borne out that the service reductions that we did make were effective at mitigating those impacts to our low-income and our BIPOC riders.
Thank you. Councilmember Cameron.
Thank you both for this presentation. I think, so one of the challenges that I have, and it's not surrounding this analysis, it has, I think it's more the FTA's responsibility that they placed on you, but it is, at best, this is correlational. It is what happens in the universe surrounding these communities, but it doesn't actually address from my perspective, it doesn't come close to addressing or understanding what systemic barriers are in place that prevent BIPOC communities or historically underserved communities from accessing transit. So yes, we could have lots of transit options available in all of these communities, but does that mean we have riders from those communities? And so the challenge here is that this doesn't really address that question. And for me, that's the fundamental question of, are we addressing equity as an agency? So I know you mentioned the customer survey. Are there other tools that we have at our disposal or that maybe we should start using in order to address this question. This is an FTA requirement, but what more can we do?
Madam Chair, Barber, Councilman, Member Cameron, thank you for that question. And I think that I want to mention that, and I'm going to look at like what is the frequency of a travel behavior inventory? Maybe Leslie knows, but we do have data that comes not every year from the travel behavior inventory that can tell us a little bit more about, who uses. It's an onboard survey. Who uses our services? How they identify? Where do they live? Perhaps a little bit more about their income, et cetera. So that is data that we get every, I need some help.
5 years.
Thank you, every 5 years, thank you. Every 5 years. So because it is definitely a huge project to conduct. It's very expensive, but certainly something that we look forward to use. Service development uses for, route planning. We use it for other planning and capital projects, but equity, especially equity, is looking into that data to understand better and put more context to these service equity metrics that are more on that bus stop level and who lives in that region.
And I would just add, I think that even some of the transit ridership data that we're getting is pulling more of this information in. But I would say keep asking the questions because I think we're getting better at it. But that just also means there's still room for improvement. I think we're starting to put more of the data and science behind how we look at all of that instead of just X number of people rode, and getting a little more in the weeds, which is where the real answers are. But so keep asking the question because I think even our staff is looking to figure out what are the questions that matter to us when we're looking at this data. So appreciate it and appreciate the answers. Councilmember Dolker.
Thank you. First, thank you both. Data is always good. It tells you, where you can plan, where your gaps are. And so the amount of work that went into great. Thank you so much. My two suggestions, one for you two, and then one for Leslie and the planning team. So the first one is, I think on the meeting, if you can post the entire study, I don't know if that's available or public or if it's ready for public consumption. Because just looking, if I just go by the slide deck and I look at the sort of description of each of the data you have, it's out of context. And this is where I think Councilmember Carter was having really hard time making sense, the year versus cumulative to, is this telling you because we have more people who need to use transit, so they are using the transit versus are we building transit in areas that actually need transit? So it's not telling the full picture based on the slide deck. And I have a feeling that if you actually look at the entire report that you wrote, it may tell a better story. So that's my first recommendation to the two of you, so great work. My second thing is so this is generally for the transportation team, is, I'm looking under Title VI of Civil Rights under FTA, and it says Service and Fair Equity Analysis. And, if I start scrolling, I think what Denver did was actually have transit equity manager, somebody who can move across planning to the services, to people who are administrating sort of the low-income fare. It's really looking, so instead of siloed approach, you have group who can travel multiple groups across and kind of hold the different pieces of it. Because I think some of what Councilmember Cameron is addressing is you look at the population, you look at the transit desert, and you look at the density and say, where are our general transit users? Who are the low income? And then you look at the services, right? You look at the services and say, are our services there BRT? Are they local? Are we making a cut? Is there a disparate impact on certain group of people? Are transit moving people to jobs? Is it midnight job, accessibility? Is it 9 to 4, 9 to 5, who are more catered towards users like me versus your general transit? And then there's the third piece to it, which is the fare analysis. Is our fare a barrier to using transit? And Met Council does have, and Metro Transit does have low-income programs. So then it's those programs, how do you work across? And so I think it may be a coordination across different things that's beyond your evaluation report. But in general, that's how Denver tackles sort of the transit equity piece to it. That is beyond just looking at a survey.
Councilmember Chambliss.
Yes, I was kind of just doing a search as you were answering some of the questions. And we do have a transit-oriented development guide that specifically focuses in on equity. And I think that's an area of interest for myself and probably many of the council members to kind of dig into further. And maybe that information can be shared with the FTA as well, but just something to think about.
All right, any additional questions or comments? All right, seeing none, I'd entertain a motion to approve business item 2023-210.
So moved.
Moved by Councilmember Carter, seconded by Councilmember Dokar. Is there any other discussion? All those in favor say aye.
Aye.
Opposed, nay. Motion carries. Thank you very much. All right, and I would say, which meeting is this? December? All right, I'd like to the committee to see whether they wanted Senate consent or non-consent to the full council. It'll be on December 13th. We will have a large volume of items, so.
Consent.
Okay. Your chair, thanks you. All right, we are on to information items. The first item is the onboard survey, which is well-timed given our last discussion. And we have Brandon Whited and Rachel Jones here to present. Or is it just you?
It's just me today.
Welcome,
Welcome, thank you, Chair.
and welcome to the committee.
All right, council members. Thank you for having me here today. My name is Brandon Whited, and I'm going to be presenting. Rachel wasn't aware that, well, we didn't arrange for her to be here. She did contribute significantly to this, so we thank her for her contribution. And I want to talk about the 2022 Transit Onboard Survey. All right. So what is the onboard survey? It is a system-wide survey where we go out and we intercept and interview people on the transit system to figure out who they are and where they're going and why they're using the system. We do this survey about every 5 years, and it was last done in 2016, and then this time we did it in 2022, sorry. And this data, it feeds into transit planning, including like transit ways, goes into our regional stops model, and really helps inform transit on, or like inform service development and transit planning in the region. The last survey we did was during 2022, and it started in April, and it went until to December. In total, we collected a little over 30,000 surveys from folks on the system. 3/4 of those were on a weekday, and 1/4 of those were on weekends. And what I've included in this graph is when the survey periods are relative to totally monthly ridership. So you can see that the previous survey in 2016 is like a whole different scenario than what we were looking at in 2022 after the pandemic. So we're going to do a lot of comparing and contrasting of what people said previously versus what people are saying now. And I would like to, well, we're going to start with who rides. So what we're going to talk about, and I want to take a quick caveat, there's going to be a lot of graphs in this, so if anybody would like me to dwell on a slide or have any questions, please feel free to ask. And I also want to point out that all of our graphics are done as a % of trips that are delivered to service. So this is because of the way the study was designed, and we interviewed people on their trips and asked about what they were doing, like asked about their trip. So first we'll start with looking at the racial breakdown of people's trips, or of people who are taking trips on transit. 3/4 of our transit trips are made by people that identified as Black or white, with the biggest single group being white riders. Then with 45%, the next group being 31% of people identifying as Black. I do want to point out there's a term that not everybody is aware of with MENA, M-E-N-A, which is an abbreviation for Middle Eastern and North African folks. So to compare the racial breakdown between 2022 and 2016, we're looking at this graph. So to take a quick explanation of what we're looking at, the top graph is really the same data, but visualized a little differently. The bottom graph is the same data in 2016. And we flip this horizontally. And we've also omitted the people that identify as white in the survey. So we can take a look at the Black, Indigenous, and people of color, which I'll refer to as BIPOC. And what we see is going from 2016 to 2022, we had a significant increase in BIPOC population, going from 42% of rides delivered to them to 55%, with the single biggest group increasing is the people identified as Black. Okay, breaking this down a little further, we're going to compare transit riders to a regional population. This is a similar comparison, except for we're comparing against, instead of the previous survey, we're comparing against the ACS, or the American Community Survey. It's an ongoing survey, and this is the 5-year summarization of that data. And what we see is the BIPOC riders constitute 55%, similar to the previous 2 slides we looked at, versus the regional population. BIPOC constitute about 29% of the regional population. So you can see that rides on transit are represented. BIPOC riders on transit rides, excuse me, are represent more than the regional population, share of the regional population. Switching to look at the gender breakdown. The males represent the greatest percentage trips at little over 50% or 50.5%, followed by females. New to this survey, we did ask about non-binary and transgender and other identifications of gender. And new to this survey, we did enable participants to select multiple categories. So we're going to take a similar look at this data in comparison to the regional population and the 2016 onboard survey. So the bottom 2 bars on this graph would be the 2016 versus the 2022. And we do see the 2016 having a higher percentage of both male and female, but we did not ask about other categories in 2016, making the comparison a little more challenging to interpret. However, that said, we are confident that there is more female riders than male riders on the system, even though we added additional options for people to select. And there's a similar challenge with the regional population in the ACS data that they do not offer, they did not, or had not previously, offered any other selections than male or female. But we can see that the transit trips taken by male riders constitute a little higher proportion than the regional population. Next, we'll take a look at the age breakdown of transit riders. We see that the under 15 group of transit riders constitutes about 1% of the rides. We know there's a little bit of an undersampling there due to just the way sampling is done and challenges they have with sampling folks that are younger and approaching children and such. However, going into the ages of 16 and 17, we see we got 3% of transit trips are delivered to them, with the largest group being the 18 to 24-year-olds, delivering 29% of trips. From there, the number of trips delivered to the increasing age categories declines as people progress through them. We'll take a similar look at this in relation to the regional population and it's the 2016 survey. So on these graphics, we've called out all the groups younger than age 35 It's kind of like a nice delineation point. And we see that in 2016, 56% of transit trips were delivered to people reporting under the age of 65. While in the 2022, that dropped to 54%. And if we compare that to the regional population, that's only 48%. So we do see we have a higher representation of people in the younger categories. With the biggest change being that the 18 to 24-year-olds in the regional population is 8%, and that jumps up to 29% on the onboard survey in 2022, and it was 25% on the onboard survey in 2020 or 2016. And then as we get into the age categories that are 35 and older, we see that the change isn't as big, and it's decreasing compared to the regional population. Next, we'll take a look at income reported by people taking transit trips. The biggest single category people reported on in the survey was they preferred not to identify their income, at 24% of transit trips reporting that. The next biggest was people making less than $15,000 at 21%. From there, it seems to, from the 15 to about the $100,000 household income range, it hovers around 12%, with a little smaller in the 25 to 35 range. After household income is beyond 100,000, percent of transit trips is reported a lot less. So now we're going to compare this against the 2016. We did not compare this yet against the regional population, as the data sources do not fit together quite as easily, and more analysis is required for that. What we do see in this graph is between 2016 and 2022, the people reporting less than $15,000 in household income went from 15 to 21%. So there is about a 6% increase of people in the lowest income category. After that, the income categories are roughly similar between the 15 and the $60,000 household range. And then we do see a large decrease also between 2016 and 2022, or no, sorry, a large increase between 2016 and 2022 of the prefer not to say group. The next question that we are covering is we asked people if they identify as having a disability. In 2016, 90% of folks reported as not, or 90% of trips were from folks reporting that they do not have a disability. However, in 2022, that dropped to 84%. Conversely, the folks reporting they do identify as having a disability increased from 9% to 13% of transit trips. And the prefer not to say group also increased a little bit as well. Folks that ride the transit system speak a lot of languages. We asked folks what if they speak a language at home other than English, and we found that about 18% of transit trips go to riders that do speak a language other than English at home. The biggest of those categories is 6.9% of people speaking Spanish at home, followed by Somali at almost 2%, and then Mandarin, Hindi, French, other, Arabic, and Hmong falling under 1%. There was 87 more languages people reported speaking at home that all added together to be about 4.2%. The survey asked about employment and student status. On here, we had the biggest group at about 48% reporting, or 48% of trips reporting full-time employment. Of those, 44% of those did not identify as a student. We had about 22% of folks reporting part-time employment, with 13% of them identifying as a student. We had 9% of transit trips going to people that said they were a student and not employed. Employment seekers constituting about 8% of trips, with 3% of those being students. Retired folks constitute about 6% of transit trips, and discouraged workers, as in people not looking for work, not employed, not a caregiver, or retired, constitutes about 5% of transit trips, with self-employed and caregivers rounding off around about 1% each. All in all, 88% of transit trips go to folks who are participating in the labor force. And next, we'll chat about a little bit about how, why, where, and when transit riders or transit trips are being delivered. So, trip purpose. The biggest single category in trip purpose is the commuter, people reporting that their trip has gone to commute, which totals up to about 35% of trips. We split that up by off-peak and peak, and that being that the peak riders constituted about 20% and the off-peak about 15%. The next biggest category was shoppings and errands. About 23% of transit trips went to people saying their trip was for a shopping or errand. Followed next by going to college or university, then social, dining out, and medical. And then like the others are a little lower there. If we compare this against the previous survey, we see a pretty big difference. In 2016, the onboard survey, people reported commute at 48% of trips, compared to what we saw in 2022 is 35%. So we did lose people are reporting a lot less trips are for people reporting that their purpose was for commute. Conversely, errands and shopping increased from 8% to 23% of trips or people are reporting. Next, the college and university also increased from 14% to 17%. And then the dining and takeout where are we at? Oh no, so, social and community stayed up roughly the same, only losing 1% between 2016 and 2022.
Councilmember Vento.
I have a really stupid question. I'm probably either going to show my age or my lack of intelligence. But so if I'm not doing errands or shopping, going to school, doing something social, going out to eat, going to a medical appointment, going to the airport or to work or to a sports event, what kind of commuting am I doing?
Wait, can you repeat that one more time?
Well, I'm looking at the top bar, and it says that, you know, the commute is 15% off-peak and 20% peak.
Oh, are you talking about this?
Yeah.
Okay.
Oh, this is non-commuting purposes. Okay, now I get it. But work at 1%, what is that? I mean, how?
Oh, so that's that would be trips for people reported like going from like one work location to another work location,
Okay,
kind
all
of
right.
things like that.
Okay.
While the commute trips are people like leaving from home and going to work, or conversely,
Got it.
leaving from work and going home.
Okay, so it wasn't too stupid. Okay,
No,
all
no.
right.
Councilmember
Thanks.
Cameron.
No problem.
Pardon?
That makes sense.
Oh,
Councilmember Cameron.
Sorry, I apologize that this is a little bit off topic for this particular slide, but I have to get going. So
Sure.
one of the questions I wanted to ask, just going back to the sample of this survey, is it, what is the ridership? Is it exclusively local bus? Does it include Express, BRT, LRT, Metro Mobility riders. So
Chair Barber and council member, the scope of this survey was all routes, all directions, and almost all times of day. The times of day were binned into like morning, midday, evening, and stuff like that. So, yeah, so this is supposed to be a very comprehensive survey for the whole system.
It informs a lot of our work as we look at these building things out, so it's like they really try to take a big picture look at everything.
And just to add to that, so the intent and the design of this survey is very carefully crafted so that it can be an accurate representation of this is what is happening on the transit system, that we can represent to FTA and others as, a very robust picture that is, it's carefully controlled to be completely representative, as Brandon said. I had a question, Brandon, in the next slide, and we'll get you back going on it. But in the 2016 survey, did that differentiate between peak and off-peak, the way that you have on the previous slide?
So on this slide, there is a peak and off-peak. Yes, we can do that. The 2016. I did not split it up for this graph to kind of try not to overwhelm the information being presented. But yes, that we can look at that split as well. We did not for this particular presentation. And this is really, we just received this data about 6 weeks or maybe 2 months ago. So this is a first look, and there is a lot more in-depth analysis to be coming out of this.
I will just say, just looking at this slide, that's just amazing to me. That's really a significant shift in how people are moving around. And I'm really, I'm glad we're going to keep digging at the data. But I'll turn it back to you.
Thank you, Chair. So in this survey, we are also asking about people where they're going. And what you're seeing on this dot map is like destinations of the trips where they were reported going that are not home. So if they are going from home to somewhere or going, that's represented on this trip. And this is not, or on this map, this is not transit stops, but their actual destinations. The biggest destinations, if you look at like individual spots, are going to be downtown Minneapolis, the U of M campus, Mall of America, the airport, and downtown St. Paul. However, you can see they are scattered about the region pretty thoroughly. And we also looked at the time of day that when they're going. And I split this out by trip purpose, so we can see what the different purposes are of the time of day. The height of these graphs is not meant to be compared against each other. These graphs are really meant to show when people are taking these types of trips. The airport we see is multi-peaked, and people going like kind of throughout the day at different times. We see that the traditional kind of peak commute trips are work and college and school, where we see work is peaked in the morning highly and a little less peaked in the afternoon. That'll largely be because people tend to make other trips after work, like going to some of the other things like social engagements or shopping and dining out and stuff, more so after work than before work. College is peaked in the morning, or college and school is peaked in the morning, and a little steeper peak in the afternoon. We will point out that I don't have it there. I was asked to point out that the more peaked commute has changed a lot since like the previous survey, that we do see less trips going to these traditionally peaked commute, or kind of like peaked transportation, or no, what do I say, peaked trip times than before. A couple other things to note is, if you're going to sports events, social community, shopping, and dining out, they tend to, trips for those purposes tend to scale up through as they go through the day. Your shopping, well, in shopping and errands is a little more stable through the day. And we see that medical trips are definitely definitely skewed to the earlier times of day and taper off as we get later into the day. So we with the survey, we do get a sense of what people are doing and the times they're doing it. And I believe that is the last slide. Oh, I thought there was a thank you slide. But special thanks to Rachel Jones, who helped tailor these slides and make them as nice as they are. A special thanks to Rachel Dunka for also helping with this. Jonathan Ehrlich is the manager of this. And ETC was the folks responsible for going out and collecting the data on the system.
Okay, thank you very much. Councilmember Dolkar.
So I have a suggestion and then a question. And yes, the slides are really nice. The time of the day tags sort of what we know anecdotally, and it's good to see in data. So I'll say what I said it previously. I think if you can have the report on the committee website or the committee meeting, I think that will help. It would help answer the question the Councilmember Cameron was asking about. Where did you take the survey? Who was the universe of the people you were taking the survey? Some of the explanation that doesn't go on the slide deck could go into the report, and that would help explain somebody who's like looking back. And then on the slide deck itself, you know, Councilmember Vento, I completely understood your confusion, because I think if I was like if I was a person walking down the street and just taking a look at the slide deck, even I would not be able to tell the difference between the commute and work.
Right.
That really came out. So you either have to be listening to the whole session of the council committee meeting, or you have to read the report. So that doesn't come out clear. So I think having the report, my guess is more or less people who are really interested are individuals who are going to read the full report. So that's my suggestion. The question I have is on the income survey that you had, you know, 15K, and then it goes up by another. Was that, help me understand, how did that income category came about?
So the less than 15K?
Just in general, the way the incomes are bracketed out.
In the survey design, I'm sorry, Chair and Council Member. Another thank you to my predecessor who kicked off the survey, Ashley Asmus. Some of her work with the contractor and looking at previous surveys, like determined these buckets.
Okay.
So these buckets, I think, are partly aligned with the ACS, designed to align with like other data sources, and then also so that they're comparable to previous surveys.
Okay. That's really helpful to know. So I'm not going to speak for the other council member, but I was thinking, where does the income bracket come through? And if I was making some type of policy decisions, like how do I frame it, you know, like how do I think about the income, and how do I think about the way to use this data to help inform policy decisions? And my immediate thought was, you know, Minnesota has MinFeb, you know, there's the federal income guidelines. I'm sure on the housing side with Metropolitan Council, there's some type of income guidelines or household income. Like that type of data helps me say, and then if I say low income or if I say X, you know, characteristic, I can, so if you're saying this is tied to ACES, then makes sense. If not, then, you know, some type of council policies or council data that is used around income would be really helpful. Because if you think about policy decisions we make, we don't make just on transportation, we make it on housing, we make it on transportation, and then somewhere on the environment that I'm not familiar with. And if we start seeing things like low income or low wealth, like it would be really good across the institution to like know what we mean. And so when I think about this survey, my immediate gut reaction was say how the income brackets were explained. And so if I'm making policy decisions based off on this, like I can tell. Because otherwise this just looks like 15, 25, and then 35. And then all of a sudden it jumps, and then it jumps by like another 50K, like 200 and 200. So I wasn't completely clear, like when I'm looking at this, that this is tied to something. So that would be my like revisit, clarify, And if it's based on American Community Survey that is done nationally, then yes, like use that, because that helps too.
You know, and I might revise that statement. That is, I think it is more tailored to be conducive or like be comparable to our previous surveys than
Okay,
American.
all right, let's not do that then.
Okay.
Like, forget about our previous survey. Like, as we make policy decisions, previous survey, sometimes it's good. Okay, now I'm speaking only for myself, not to the other council. Like, it's helpful to see the trend, but not helpful in policy decision making. So if you coordinate this with, housing is the one that I'm thinking of, because they do use income guidelines. That would be really helpful to see. Then it's, institutionally you have a data, and then I can see like what that tells me.
Sure.
Thank you
Thank you.
for indulging me on this. This is like a little bit of fishing.
My
Councilmember
pleasure, Chair-
Chambliss.
Madam Chair.
Yeah, I'm kind of a data geek myself, so I appreciate your comments very much. I think this is all very good data, and it makes you want to dig in, well, at least some of us want to dig in more. And asking the question, why is this information important, or how might it be used, I think would answer some of council members' questions. And not just for this presentation, but anytime we do our graphics. And I also liked your point that if it's, a person who's not on the council or is not an analyst, how might they be able to perceive or use or understand this data if they were listening to it online, or if I go back to it 6 months from now or a year from now and I forget about what was said, then it's much easier to see, because this can be very valuable information, all of it.
Thank you, Chair and Council Member.
Additional questions or comments? I just have a question, and it might not be for you, Brandon, it might be for Leslie and Charles, but, we do this every 5 years, so like this was initiated 2 years ago. So some of the questions have changed probably since we did this, but there's a lot changing right now in real time. So are we gonna do any kind of even sort of sampling of some sort to know this was a snapshot at a particular time? Like I said, everything's quickly changing, so just curious.
Yeah, Madam Chair, council members, it's a very large survey effort. As the slide early on that compared the little points in time that we did these surveys, ridership has grown since then. Things have continued to evolve since then. We don't currently plan a sort of survey refresh per se, but certainly it's a possibility where I think our intention is to track ridership. Keep an eye on where the system continues to recover and grow, and if we feel like it's really changed, it's certainly something we can revisit, either on a light touch basis or a full survey redesign. This survey is incredibly important for our transitway planning efforts in particular, and it's not just that the volumes changed, it's that it's really different music that we're hearing in the system, and some of the dynamics of that are seen in this presentation. So we want to make sure that we're accurately capturing the system, regardless of when that is. So we'll continue to monitor the ridership that's out there and make our plans accordingly.
Perfect.
I don't
Councilmember
want to
Chambliss.
drag the conversation on, but I think it's very important, especially when you're going back all the way back to 2016, not to change too much. I mean, if there is different information, I think it should be on a separate graph. Otherwise, you end up skewing the data or it becomes less valuable.
I don't disagree with that. I just worry that this was a snapshot, really, a lot of it was last year. And even now, we see something different. I mean, we are making this particular set of data, and we saw part of it today, but really informs a lot of we build out our transitways. And so I think, I just want to make sure that I like the idea of watching. If we do see big changes in ridership, maybe we revisit and do some sort of sampling to see how it lines up. It's kind of like we did a pilot for this one because we weren't sure what we were going to see after the pandemic either. So. All right, additional questions, comments? All right, thank you, appreciate it.
Thank you, Chair.
All right, now we're on to our next information item, which is the Metro Move service. We have Sheila Holbrook-White here.
As Sheila makes her way forward, Madam Chair, I'll just say that next meeting, we expect to award a contract related with this service. We wanted to remind the committee of what this new program is before we then next time focus maybe more on the procurement itself. But with that, I'll reintroduce Sheila Holbrook-White.
Thank you, Charles. Madam Chair and council members, I am Sheila Holbrook-White. I'm the Waiver Transportation Program Manager working in MTS. And I have to tell you, it is a huge pleasure to present to you all together again. For some, this will be a refresher from a presentation made about a year ago. And then for others, this will be perhaps the first opportunity to learn about this evolving program we call Metro Move. So I'm going to give you a quick overview of the program as we begin. And so Metro Move is a new program of contracted services that will be managed by MTS. It is a program that fits in the same state statutory bucket as Metro Mobility. So it, along with Metro Mobility, will be part of the state's forecasted budget beginning in 2025. It is focused on customers with disabilities who receive home and community-based waiver services funded by the state's Medical Assistance Program, MA, which is administered by the Minnesota Department of Human Services, or DHS. Critically, it provides transportation options for persons with disabilities well beyond that which is usual and customary. And so it's an innovative approach. As we talk about those service design features, know that they have been developed in collaboration with our potential customers with disabilities, their families, their allies, and others, including the county and DHS, which has been a real champion for this program. And as importantly, it allows MTS to draw down new federal funds for the region and to decrease state general funds. With that overview, there is a geographic component to this program, so I want to review two maps with you quickly. This first map shows the service area for Metro Mobility. That which is in blue is the ADA mandated complementary service area. That which is in gray is that which the state mandates that the council will provide an ADA-like service. The second map is the Metro Move service area. And beyond just the map's color and the difference there, this service is not governed by the Federal Transit Administration's ADA requirements. It instead encompasses the statutorily mandated Special Transportation Service area. With that geographic context, I'd like to take a step back to give you a sense of how we got here, because that's always helpful to know the genesis of a new service. The agency contract was originally designed and deployed in the mid-1990s to carve off trips that were going to, at that point, what were known as adult day services and day training and habilitation services for folks with disabilities. The idea that you would put those trips, routine weekday trips, into a separate contract. The agency program, as we know it, has evolved over time. And so in 2018, MTS procured the current agency contract, and it is a subset of Metro Mobility services for Metro Mobility certified customers, provides weekday service to and from what we now know as day support service programs to the 9 largest in the region. All the trips on the agency contract begin and end in the federal service area, that blue portion that we showed on the map earlier. Most individuals with disabilities who attend a day support program travel oftentimes multiple days, weekdays, some up to 5 days a week, and they are picked up at the same residence, taken to the same location at the same time each day. So their agency services end up being kind of configured like a school bus route. It's the same driver who comes by and picks up the same person in the same sequence, takes them to the day support program, and then takes them home again in the afternoon. And passengers are charged the posted fare. So for the agency program, they pay $350 non-peak 450 peak, just as any other Metro Mobility customer would on demand. What's critically important about these particular passengers in the agency program is that more than 90% of them are receiving what are called home and community-based services funded through DHS. So DHS actually pays for most of these services. And they are, it's part of that waiver program, that set of services that allows an individual with a disability who would otherwise require institutional care, for example, in a nursing facility or a hospital, to live in the community they call home, often in their own in a private home with family members and others, or in a group home. And so transportation ends up to and from day support programs is one of those services that home and community-based waivers can be used to subsidize. Although the cost per trip for agency costs MTS about $38 per trip, we can only charge the $350 and $450, the Metro Mobility fare, because the Department of Human Services is not allowed to pay more than that which it would otherwise be required to pay for something for the general public. It's considered to be a usual and customary fare. The intention is good. You don't want the Medicaid program to be gouged for the cost of service. It does present an issue. So before we go into the issues it presents, I want to give you a brief history of MetroMove. So concurrent with the agency program, the Minnesota legislature mandated a Metro Mobility task force. Membership included Committee Chair Barber, and she nods her head. In February 2018, the task force report was released. In its exploration of Metro Mobility, including its design and the increasing cost of service year after year, the task force issued some key recommendations, including, we want a system that includes more service options with a clear recognition that these options should support customer choice, and two, that the system should maximize all potential funding resources. Within that recommendation, the task force, which issued this report unanimously, recommended the determination of, quote, how county DHS Metro Mobility can coordinate services and funding to capture all eligible federal dollars for waiver transportation, the very service we're talking about. Related, the federally required Public Transit and Human Services Transportation Coordination Plan, which included stakeholders across the 7 county regions, said, seeking opportunities to use existing funding sources more broadly, including reviewing funding programs for opportunities to expand eligibility or use of existing funding streams, was a high priority for the region as a strategy. And the Olmsted Plan, which is a living document that lays out the state's ongoing effort to provide individuals with disabilities with more opportunities to live, work, and play in the communities they call home. The importance of transportation is flexible. That facilitates critical connections, particularly to competitive employment, to community opportunities, has been consistently highlighted. So while all these plans were in development, MTS began a constructive and ongoing dialogue with DHS. Recognizing that DHS could only pay the usual and customary fare for services like that provided under agency contract, the question was there a way to close the gap between what was being paid by DHS, $350, $450, for a $38 trip that MTS was providing? And there is. To increase the council's share of waiver funds beyond the adopted fare structure and to capture those additional federal funds, DHS said, MTS, you need to develop a service that is not the usual and customary, something different. So in partnership with potential customers, their families and caregivers, counties, DHS, and others, we have worked through some critical service design elements, problem-solved operational issues, and even chosen a name collaboratively. That not usual and customary services, MetroMove. The council enrolled as a Minnesota healthcare provider in July 2021, and we are now eligible through this new program, MetroMove, to bill DHS directly for the market rate of waiver transportation services that the council negotiates with the 7 metro counties. In this summary slide, I want to highlight some specific features that were created in collaboration with potential MetroMove customers, their families or allies, and others. MetroMove serves the statutorily mandated special transportation service area without the distinction of the blue and the gray. Thus, the opportunity and means to attend and participate fully, for example, in day support programs of your choice, of one's choice, not the one that's necessarily closest to you, and to access community resources is no longer challenged or conditioned by the points at which you begin or end your trip. Because days and hours of complimentary ADA paratransit are aligned with all-day fixed route service, service availability often differed community to community, even neighboring communities. We heard consistently from individuals, their families, allies, and others that this patchwork of hours, this patchwork of trips, made it difficult for people with disabilities to find and keep a competitive job in the community. Having greater connectivity to and from and among communities across statutorily directed special transit agency 7 days a week with a consistent and uniform hours speaks directly to the input and engagement of individuals with disabilities, their families, their allies, and others. We also wanted to keep a really critical feature, though, in MetroMove that we have. I mentioned agency trips are like school trips. Minimal fluctuations in drivers, customers, locations. Relationships are often built and cultivated between that driver and that individual they take to and from the vehicle each day, and their family members who often greet them at the door. And we found in our collaborative work that that regularity, that familiarity was much prized. So the first door through first door escort function remains in place, and we will work with the selected contractor to replicate as feasible that recurring driver assignment, so you know who's coming to your door and with whom your loved one is traveling on their way to, for example, day support programming. So what are the financial impacts and implications for MetroMove? An agency trip costs approximately $38 to provide. Under the current services, DHS purchases a fare of $4, averaging the $3.50 and the $4.50. $2 of that is covered by the DHS state share, $2 by the federal share. MTS receives $4 of Section 5307 funds. The remainder, the $30 of that $38 ride, is covered by state general funds. Under MetroMove, because the council has successfully negotiated a market rate of $26 per trip with several metro counties for a MetroMove customer who is ambulatory, that's the financial impact example you'll see here. As an enrolled provider, the council will bill DHS for $26. Half of that, $13, comes from DHS state funds, the remaining $13 from DHS federal share. MTS Section 5307 will cover $4, and state general funds will provide the remaining $8. So the net increase in new federal sources to the region, $13 per ride, and the state general fund contribution drops by $22 per ride. So what lays ahead? Council staff are completing the procurement process. We are completing market rate negotiations with the remaining 2 counties in the metro. We are launching outreach, communication, and education campaigns for county social workers, managers, disability service allies, caregivers, and others, particularly those who have a direct role ensuring that individuals with disabilities make an informed choice among qualified providers. We are creating supports to assist waiver participants eligible for transportation, including things like fact sheets and videos and a whole bunch of fun stuff. And we expect that MetroMove will launch service during the second quarter of 2024. And with that, I want to thank you again for the opportunity to provide you with an update and share this exciting venture, and I stand for any questions.
Great, thank you. Councilmember Vento.
Well, Sheila, thank you very much. This was really, really helpful. When I first came on the council, one of the most challenging issues I dealt with was a person in my old district who lived outside the federal and state lines and was a state employee and had broken his leg in multiple places and needed to get to work after surgery and some at-home healing. And thanks to the Metro Mobility and the transit staff, we were able to work something out. But for a number of us on the council, when we look at our districts, they're in the white. And I would love to have a conversation sometime when our agenda allows for us to talk about, the history of this and why it came to be the way it is, and the politics of it and why it continues to be the way it is, and whether or not we're in a position where we should be talking with the full region or those portions of the region that are outside the boundaries about what their desires are. I know of a couple of communities where they've got growing populations and they have growing senior populations, and with growing senior populations come growing disability and need for Metro Mobility services. So I'd like us to think ahead about whether or not we need to spark a conversation and be leaders on this topic. If it's best to leave it alone, I'm fine reaching that conclusion, but I'd like to have a discussion about it and know both the history and the opportunities that exist, if that makes any kind of sense, Charles.
Madam Chair, Councilmember Vento, absolutely. I think there's both, what is the history and status of the Special Transportation Service area, the Metro Mobility and Metro Move area, but also, which is set by the legislature. Yep. But beyond that, what can we do to make sure that we're addressing the transportation needs of people in that area, in the white on that map, in those outer areas, both from what types of services are available, but also when those services are available, where they go, how useful they are. And pleased to report that we have work planned in all those fronts.
Well, Madam Chair, if I could, I do know that there was a recent conversation between Councilmember Cedarburg and leaders in the Forest Lake, Columbus, Hugo area about this. And there's a sizable portion of part of my new district that having been at a recent meeting, I think there might be some questions about it there as well.
And I'll turn it over to you in a second, but a couple of things. If you go back just even over time in 2018 with the Metro Mobility Task Force, even, some of the things coming out of that are stuff we're seeing now, like this program, which is just makes me very pleased. But also looking at, the funding and how we do some of these things. The laws had to be changed to get to this point, that we needed to be able to, free up so we could have conversations with DHS. It was even down to that level. And now we're in a different place financially where I think, a lot of our decisions on Metro Mobility and Metro Move are pretty constrained with finances in the past few years. But now's the time to have some of those conversations for some of the other areas, and I'm glad to hear it's on the work plan. So, all right, so I'll turn it back to you.
Yeah, thank you, Madam Chair. Sorry for jumping into the conversation. I'm John Harper, Manager of Contract Transit Service in MTS, and I just wanted to come up to the table here and share with the committee how innovative this program is. We didn't talk about it in the formal presentation, but I want the committee to understand that this is really, it is really a turn for this contracted service to move away from strictly doing public transit with an ADA emphasis or an ADA requirement and turn the corner into human service transportation. And we hired Sheila 2 years ago, almost to the week. Yeah, I mean, it's very, very much 2 years ago to do this for us because she has the human service expertise as opposed to me who manages her with a public transit expertise. But we presented this at this program at the APTA Mobility Conference this summer when it was here in Minneapolis. And people in the audience were wowed that we were doing this change. And subsequent to that, we have presented, mostly Sheila has presented to the Intergovernmental Issues Legislative Subcommittee of APTA, the Public Transit Association. And Sheila just 2 weeks ago was out in California presenting to CalAct, their statewide conference in California. And so this nationally is innovative. We are being asked to talk to people around the country about how did the Met Council and the state DHS get together to to turn this corner and develop this program. So I didn't intend to come up to the table, but I thought that it was important to share with the committee that. And we are trying to do it, to get to your point, Member Vento, if I may, Chair, we've got a number of constraints under which we're working because this is a public transit agency. And to start doing this kind of program, we're doing it and trying to not have to do legislation and trying to just turn the corner and then start to move down this other road and harness these other financial opportunities, right, to get federal funding where we're doing state funding today. And so it is a process. There are other programs that we do, and this isn't the only program. And so with Transit Link, we do service in Forest Lake, for example, and service in Rogers. Those have been two areas where conversations have been had recently about what do we do and how do we do it. I think to a certain extent it is about making sure those communities understand what is available. But we certainly are operating under certain constraints. And so just to share that, but we should celebrate the fact that we're moving this program forward. It is very innovative for the council, and it is going to be a change, and it's going to be it's not going to just be Q2, we move everything and away we go. It's going to be a process for us. So anyway, just wanted to share that with the group. Thank you for indulging me.
And thank you for sharing that with us, because this was, like I said, it was a big challenge, but it's also it's nice to hear how it's being recognized by peer agencies as well. Councilmember Vento.
So Madam Chair, this will go, we'll deal with this at our next meeting in a motion?
Correct.
And then it'll be on the December 13th council?
Correct.
I'd ask that it be on the non-consent agenda so the point can be made about what you just said, John. I think it's important for the full council to realize how innovative this is and to know about it. So I would appreciate that.
Thank you. I think we can arrange for that. I don't know that we'll have a presentation because
Right.
Becky said something about 17 or 19 business items, so we'll figure out like what amount, but maybe we can even have a little more in the language of the business item with some background or
great.
something attached. We can figure something out for that. All right, additional questions or comments? All right, thanks to both of you. I really am excited to see this.
Pleasure.
So it's
Thank
great.
you.
All right, now we're on to our final information items, the fourth quarter service changes and workforce update. We have Adam Harrington and Brian Funk.
All right, good evening, Madam Chair and council members. Brian Funk, Chief Operating Officer, Deputy General Manager for Metro Transit, joined by Adam.
Adam Harrington, Director of Service Development.
So today we're going to be providing you with a brief update on workforce snapshot, specifically for our bus and train operators, as well as some of our key maintenance positions, and then I'll hand it off to Adam for an overview of our upcoming service changes. So one of the things as we get started I'm most proud about from my colleagues across the council is that we're saying a good news story for the fourth quarter in a row. And so we really have taken to heart that making a Metro Transit a great place to work and build a career is something that many of us have found during our time here with the council, and we want to extend that to our coworkers as we both attract new employees but also retain our current employees. And so moving forward, here's our snapshot for bus operators. And so this is as of October 31st, so through the end of the month. We're seeing that we're in really good shape, and that's allowing us to continue to grow our service. We've been able to hire over 360 new bus operators this year. Meanwhile, we've had a number of people, of course, complete their career with Metro Transit, move into other roles, and gain promotions. And so the net increase of well over 100 people is fantastic. At the beginning of the year, in partnership with the Human Resources Division, we set a target of aiming for 400 new hires. We all thought that was incredibly aspirational, but I'm really happy to say that we're going to be able to go past that and really move forward. What that does signify, however, is that we have a lot of really new people joining our ranks, and so that's great, but as we move forward, that is incumbent on us to be able to build and support new employees. We still have a very healthy pipeline for our operators on the bus side of the organization, with almost 250 people who are in various stages of the hiring pipeline. So there are people who have submitted applications that are being reviewed, they're processing for interviews, they're going through background checks, medical exams, things like that through a multi-step process. But we're really encouraged, thanks to the sort of additional parameters that this council had provided towards the end of last year. We had a wage increase that made the position more attractive for people to come in and join the organization and then stay here, which is great. And one of the other innovative measures that was taken between our workforce development group and operations at the beginning of this year is to start a paid CDL permit training program. It's one thing that is not common in the industry, and John had talked about us being sort of trailblazers. This is another area where we identified that a number of people really wanted to start with us, but had a hard time clearing the hurdle of getting that commercial learner's permit. It is something we need when people start in their training class, and so we developed a program. It's about 6 days long to really do an intensive deep dive into that program. People are paid the full wage rate when they start, and it gives them a guaranteed landing spot into one of our training classes as soon as they complete that program. You can see here that it's clearing over 90% of people are passing that. And even the people who do not pass that training program, if they're able to successfully get that permit on their own, they're able to join the next training class. So it's a good news story all around. On the train operator side, council members may remember that late last year we had changed contract language with the ATU in bargaining, where we reopened the contract. From the time that Hiawatha or Blue Line opened pre-2004 until the end of 2022, the only pathway to become a light rail train operator was to first be a bus operator and then internal transfer program. And so we recognized that we had both today's needs, but then of course the needs for our expansion projects, and negotiated a change in that language. So now external applicants are also able to apply to be train operators. We've seen great results. I've reported before a high number of applicants wanting to start with us. And you can see the curve is bending back in the right direction. So now our workforce is matching our current need. And we have both people in training right now to bolster those current numbers, as well as more starting at the end of November and into early next year. And we'll be posting for more positions in early 2024 with a goal to be able to try to increase our frequency on the light rail as well sometime next year. And so then I'll move into our maintenance staffing snapshot. Operators are a key part of the equation, but so are the people who maintain our vehicles, clean our equipment, clean the facilities, and ensure that we're able to deliver that high quality service for our customers. And you can see here that for as many successes as we've had hiring operators to deliver the service, we are still continuing to face significant challenges in our key maintenance areas. This comes on the heels of a great legislative session, but with that comes mandates for improved response time for cleaning and repair of our vehicles and facilities. And so this is an area that I know myself, the general manager, human resources are really leaning into. The maintenance teams have done a fantastic job this year to increase their presence in outreach events, trying to double down on our apprenticeship programs and start new programs. But it's going to really require us to lean in even harder in all areas and do a full review of, what are we doing for compensation? How does that compare to the market? What does our starting wage versus the progression look like? And all of those factors that are sort of ongoing right now. So I intend to build this in and make this a regular part of the reporting as well. As I said, we're able to deliver the service, but we need to keep the vehicles and equipment running and clean. So. And then finally, I certainly welcome feedback on the way that this data is displayed. There's a lot of key roles who go into making our service reliable and clean. Highlighting these and showing the vacancy rate we felt was the most effective For example, fourth from the bottom, the signals technician position for light rail. Super important from an absolute number. It wouldn't stand out if we showed it in a bar graph or something along those lines, but not having 5 of your 15 people is very significant for that department. So again, we'll continue to report on this and be able to hopefully very soon here report on progress. We're making good moves in this area.
You want to pause for a quick, Councilmember Chambliss?
Thank you. Thanks for this information. I heard you mention that you're doing outreach to get the word out about these jobs. Are we working with training organizations? And how are they being supported to help get people the skills or pay for the training so that they can be feeders into these jobs?
Madam Chair and Councilmember Chambliss, we are and we're going to continue to lean in heavily to that. We have a workforce development department who, for the last about 5 years has been working to bolster those connections and make sure that we have a presence in the job development organizations as well as secondary and post-secondary schools. And so if you'd like, I can provide some more feedback about some of the specific work that's gone into those areas.
I think that would be helpful.
I think that would be good. And also, like, just looking at some of these, like you said, signals technician, does that person need to be an electrician? I mean, like, what are the skills kind of to feed into some of these jobs? And, are there other technical programs and technical colleges that we should be looking into that can have skills close to this, but then be able to work into these jobs?
Yeah, Madam Chair, and just to briefly address that, I think that is something that we can definitely come back with, and we can do a deeper dive on a few of these key positions. I think most people are familiar in a general sense with what a bus mechanic technician is going to be working on, but to your point, Madam Chair, the signals technician is another one where there's a limited population, and so we continue to work on programs that both recruit people with the skill sets we're looking for, but then also figure out ways that we can build our own and develop people through those types of trainee programs. The track maintainer is another example of that.
General Manager, then we'll go to you.
Yeah. Chair Barber, council members, didn't mean to interrupt Mr. Funk's comments there, but I was just going to mention, and I think this has come up before, but on December 6th, Cassandra Tabor, the new Chief Human Resources Officer, and me and possibly some others from Metro Transit are going to provide a high-level Metro Transit workforce presentation, both looking at our current state, but also looking at the fact we know we're growing. And so this is a really helpful conversation. That may not be the presentation for all these deep dives, but certainly I'm hearing we'll want to address workforce development work as part of that. And just wanted to mention it now because if there are other questions we're not really getting to today, there's still time to help shape that December 6th presentation as well. So.
Perfect. Councilmember Vento, and then we'll go over here.
Thank you, Madam Chair. I'm curious, Brian, as to if we have any sense of where job satisfaction fits in as far as the vacancy rate. And the reason I'm asking is I'm a third generation teacher by original profession. And I remember my mother, as I was starting my teaching career back in the olden days, telling me that, yeah, it's important to have a good relationship with your teaching colleagues and your building principal and those folks, but just remember who really helps support you. And she noted the custodian and the school secretary and the school nurse and the aides. And she really drove the point home. And I learned within just a few days how important that custodian was to me in terms of coming in and cleaning up situations. And so whatever we can do as a council I know we have our employee appreciation events, but to really single out this crew, they're they are unsung heroes when it comes to our transit system in many respects. So just wanted to note that. And does job satisfaction fit in?
So, Madam Chair and Councilmember Avento, yeah, a couple things on that. So, one, I wanted to highlight these challenges so that we could talk about it. It hasn't been sort of at the forefront, as you noted, but they're critical to, our success in being able to deliver on our mission. I know the general manager and I have been participating in things like town halls to really get out and share both kind of our vision and what sort of is happening from the strategic level of the organization, but then also working really hard to hear feedback. And some of the feedback has been, that we don't like the schedules because there's not enough people and it's stressful within our ranks. And so that's something that we need to make a commitment and figure out how do we provide them with more coworkers so that we can have a better scheduling balance. And as we're trying to staff for 24/7, 365 with safety and minimum staffing, in some of our locations, not forcing employees who just got off their overnight shift back onto an overnight shift. Or if that has to happen, how can we recognize that through things like shift differentials and different schedules that make sense that the employees really are looking for if they're forced into those positions. So, yeah, it's not probably a total answer, but in short, it's something that's definitely top of mind.
All right, Councilmember Carter and then Councilmember Chambliss.
Thank you. Thank you so much for the news and for the work that you all have done to make certain to achieve these results. And I know there's more to come to get to the levels you want to be at. I'm going to ask a question in preparation for the December 6th meeting. I wasn't going to ask it because I know we don't have a lot of time tonight to develop this. There may be a lot of information I'm not aware of at this point, but very interested in your work to recruit reentry populations and to understand what policy decisions we've made in that regard and how successful we may be in establishing partnerships that will assist us to ensure that, many of the people, of course, who have gone through incarceration may be just as guilty as some of us. In other words, I've heard that presentation, we are all criminals. But for getting caught, some of us may have difficulty getting employment. And I'd love to know what we're doing here at the Metropolitan Council at Metro Transit to assist in bringing that population into our work. Okay. So that's for December 6th. I'd love to hear more.
Before I turn it to Councilmember Chambliss, so anyone who has thoughts on this December 6th, this committee knows more about this and has had more background, definitely please send information and we'll make sure it gets built in. Councilmember Chambliss.
Oh, just real quick, and you've probably already captured this, Mr. Funk, but maybe looking at the turnover rate and the vacancy rate. The turnover rate can contribute to the vacancy rate, obviously, but be good to kind of separate those out.
Madam Chair and Councilmember, we will absolutely provide that. I'm making notes, and I'll be able to work with Leslie and Human Resources on that, and then try to categorize some of the reason, right? We've had a lot of people who've moved into other roles or gotten promotions, but that's just a piece of it. We need to understand the other reasons as well.
That would be great. All right, additional questions or comments right now? Councilmember Pacheco, then Councilmember Vento.
Madam Chair, members, I was just reading the Minnesota MinPrise or Minnesota Enterprise newsletter, and they had a survey of their members, the business use and small business as well, asking what their concerns were. And then one of the first ones was obviously workers, but the next one that showed up was their response and what's required them to do in regards to cannabis in there. So now it's no longer illegal to carry cannabis in here. Or whether use it when they're not in working. And so looking at what's going to happen to the legislature, how do they really define this? Because they put some people in a tough situation. And that's the not necessarily negative, that's one thing we're going to watch. But the other thing is to address Councilmember Carter's is that how does expungement work in getting jobs or changing how is the expectations to increase the pool or not? And so there's going to be a lot going on in that. I think they're going to come back in the next session trying to clean it up a little bit because they kind of got through at the end there. But, Ohio passed it just last week, and so there's like 20-some states now that have passed recreational use of marijuana. And so again, it offers a whole nother level of issues that would have to be covered.
It's a very good point, Councilmember, and I think that, I don't know how much we would get into that in the December 6th meeting, but this is a conversation that's been going on internally already. And so it might be, as we map out work plan for next year, something good to get kind of on our list of topics to have an understanding of how we're handling all of that. Because even before the legislature comes back into session, there's still a period of time that we have to have a plan, right? All right. Councilmember Vento?
I'll pass.
Okay. All right, so turning it back to you. On to Adam.
All right, on to Adam. Thank you.
All right, thanks, everyone. So continuing on some good news here on Brian's report. So December 2nd, we're implementing new service, and it will be 12 months since we've had any scheduled service reductions. We've in fact grown a lot. It's a 10% growth over 12 months ago, which is really significant. Think about the previous conversations tonight and what constitutes the triggering for a major service change or not. And before 2020, we did a lot of hand-wringing about 1% change or 2% change, what that means. This is 10%, it's a big deal, and so we've got a lot of good positive news as ridership continues to grow. So what that looks like is these lines on the map are the routes that have frequency improvements that our customers will see. There's a few routes identified in that first bullet under service reliability, and it does tie into Brian's work and some of the questions about what the work environment is like. And we've added resources and operators to make those routes more reliable. In some ways that our work quality shows up is when our on-time performance isn't that great, which means we need to take another look at our schedules to make sure we're finding the balance between what's competitive and we're still keeping our service moving along, but what's reasonable for our operators. And so we've got some good work here that's gone into that, but we're also improving in a significant way a few key routes. One is Route 21 on Lake Street in Selby. We're improving that frequency to every 6 and 9 minutes in the rush hour on the Lake Street side and up to every 15 minutes on the Selby side of the route. And we're extending the route over to the west to see the dotted red line to Lake in France. That's going to be the new terminal for Beeline, which will open in 2025. And so we're starting to set the groundwork for that. And hopefully you've all seen the news about the new bus lanes that are getting completed now that we're able to take advantage of. So that's exciting for us to be able to finally lean into some of our key ridership routes in our system. Also in the Northwest Metro in Brooklyn Center, Brooklyn Park, we're making improvements to Route 723 and 724. We're essentially doubling the frequency on Route 724 to every 15 minutes. That's really significant. It's one of our highest ridership suburban local routes, so we're really excited about that. So a lot of good news that's in the works from a local service standpoint. And we're also making some improvements on our express service, Woodbury service to downtown St. Paul and downtown Minneapolis. It's the future Gold Line corridor. So we're strengthening the service in that area as well. So excited about this. When you look at all this service that we're adding, maybe the number of lines that we show on the list doesn't seem like a lot, but it's a lot of service that we have to add back in and a lot of operators. So it's all good news. Then continuing on, part of that good news is the end of construction season, and one of the biggest construction projects in the region opened this fall, the 3rd Avenue Bridge in North Minneapolis, which has been closed for years now. And so we're able to provide better, faster service for those customers using a lot of core local routes, as well as Plymouth Avenue Bridge. And for those of you who travel on Glenwood, that Glenwood Bridge has been out for a very long time as well, so we're excited about that. On the St. Paul side of things, there's still a number of projects that are underway, and we'll continue to have some moving detours because there's a lot of work going on there. It's not only what's happening on Minnesota Street, but it's also the improvements that we're making for a Gold Line and Beeline and downtown St. Paul and as we move to the west. So next year, we'll see more construction projects that are going to require some temporary detours, and that's really going to be the focus of trying to build some good work for both our bus operators and for our customers. So that's the summary of where we're at for December this year. What that looks like in terms of overall statistics, I've been liking to say that we're almost 90% in service hours of what we provided in 2019 on our local and BRT service. That's the lion's share of our service is on BRT and local service. So it's really significant that we're getting very close as we add that service back in, and just the conversation we just had and trying to find that right balance of we want to add the service back, but we don't want to go too fast. So we're overstepping our boundaries and overcommitting our operations for workforce. So I think we're finding the balance and continuing to add incrementally and provide reliable service. Then the last slide I have is just a reminder, we have our Network Now project that's underway, and we're using this process to help inform how we're going to continue to build our network out over the next several years. And there's some new reports out online. I'd encourage people to take a look at metrotransit.org/networknow that really review the past several years on changes that have happened, both in our service, but also the market that we're responding to. And as we move forward, we're going to be developing a concept plan that folds in things like our new metro lines that are coming online, how do we resolve some of the suspended service, and where are the opportunities to add more service or restructure routes or add new routes. And our budget right now is really what's our workforce available to do that. And it's not just bus operators, it's rail operators, it's all the support teams that make everything happen every day behind the scenes. So we're trying to be incremental, but we also want to identify a plan that's robust and helps our customers see the vision forward. So with that, happy to take any questions.
Thank you very much, both of you. Before I turn it to council members, I'm just going to say yay. It's so nice to get these, after all the the last few years, to get reports like this, it's nice to see things go in the right direction. Council members, any questions? Councilmember Chambliss?
Ditto.
It's heartening. It's a great way to end the night. Councilmember Pacheco.
It's, Madam Chair, looking back at the needs of our workforce, and I'm working with a company right now through the chamber, and rather than hire just individuals, because they can't get enough individuals, they basically are creating an entrepreneur opportunity, and these folks do outside work. They do the snow plowing, but they're commercial, so the Walmarts, the Best Buys, Targets contract them. So now they have about a year round with their service. They do the snow plow, do the yard work, and as well as now getting a contract. And so they'll give Councilmember Carter the trucks, the equipment, handle the administrative things, and you can use that on your own or just doing their contracts. And they could build their own contracts up. Therefore, they're not, again, hiring individuals, but they're hiring small companies basically and helping them grow. And that's some of the things you may want to look at is, we may be cross-rise with union work and what you have to do, but I mean, this is working out real well because they're really looking at what kind of training they could provide. And the folks that we know that are doing some of the work, as we do the work, I don't have the back of the house. I can't come down from the roof or quit shoveling to get the administrative stuff done. And so it's just something to keep in your mind that's going on. I'll show you with you more if you want down the line.
Any additional questions, comments? All right, thank you. All right, so council members, our next meeting is on the 27th, and we desperately need to have a quorum. And we have a very heavy agenda, no information items as I've been advised, because we have a lot that we have to get done before the end of the year, before our final council meeting in December. So if you're not going to be there, please let us know. We'll get some information out to, we see a couple people needed to leave early as we've gone past 6 tonight. So we'll make sure everything's out to the committees as well, but very important.
And do you suspect that the agenda may take us late? I mean,
they're not sure.
Okay.
Yeah, we can try to forecast that.
And what might go on consent and,
Right.
Yeah.
things like
We will
that.
do our best to try and streamline it, but I just want to make sure that we know, just because it's really important we have a quorum. Otherwise, you get to listen to me talk for 3 hours on December 13th. So that'd be your choice.
I'm just asking because, for people who have kids or other
Correct.
things, it
It
just
does
helps
matter.
to know. And There's also a football game at the stadium that night, isn't there? Yeah.
So I will try to avoid traffic. All right, if there's out objections, we are adjourned.
Thank you.